Well, good morning, everybody. I think we'll go ahead and get started, and hopefully Shanel will be able to join us. Jim, if you don't mind following up with her, that would be great. What I'd like to do to begin is just do a quick check-in with everybody. If we can just do some quick intros, because we do have a couple of new people on the call with us today. So you can, I'll just call out names and then you can unmute and tell us a little bit about who you are and what you're doing right now. I mean, not right now physically. I know what you're doing right now, but some of the work you're doing. Jim, why don't you get us started?
Sure. I'm Jim O'Hare. I'm the youth care administrator for the city of Roanoke. That means that we run services and provide funding for services that are attached to the juvenile court. They're not our clients, but we go and find life skills, case management, shelter care, those sort of services for young people who find themselves involved in the court process.
Thank you, Jim. Alice?
I'm Alice Burlinson. I'm a senior assistant attorney general in Virginia. I represent the Division of Child Support Enforcement, which is part of the State Department of Social Services. And I'm on this working group because there's some concerns about child support arrearages that accrue for inmates and what can be done to reduce them and also to help them when they get out of incarceration.
Thanks, Alice. Elliot?
Yeah, I'm Elliot Major. I'm the owner and director of the Dorcas Home, which is a community reentry program aligned with the Virginia Department of Corrections. We deal specifically with reentry services and opportunities for ex-offenders transitioning back into the broader community here in Roanoke.
Thanks, Elliot. Jamie?
I'm Jamie Starkey with Family Service of Roanoke Valley. I'm the Director of Community Services, the prevention umbrella of Family Service. We work with youth in prevention services like Teen Outreach Program and Positive Action Project AIM, so youth of all ages. And also we provide services to perpetrators of domestic violence. I co-facilitate those groups. So we sort of cover a pretty wide range of individuals who could benefit from the work that we're doing in this group. So it's exciting to be here.
Thank you, Jamie. Robin Mitchell is new to us today. Welcome, Robin. No, you're still muted, Robin.
Good morning, everyone. I'm here to learn and observe and just to soak up some good information, hopefully, and see how I can contribute to this amazing group that Joe has brought together. I am a community leader. I have an organization that I'm a part of called Trifecta. We do a lot of youth outreach and youth empowerment, and we're just really focused on building a better community around us. And I'm just here to learn and see where I can be of contribution.
Thank you, Robin. We're really glad to have you here today. Greg, welcome.
Good morning, everybody. How y'all doing? I'm Greg Hopkins with the Department of Criminal Justice Services. I'm the Juvenile Justice Program Coordinator. In that role, I serve as the state's JJ Specialist and Racial and Ethnic Disparities Coordinator. I'm privileged to be here. We worked with Roanoke a lot. I have actually monitored the reset grant that Roanoke just got. And Jamie, you guys have, is it the CORES or the CARES program?
CORE,
CORE, yeah, that program. And we just see if we can, see how we can be some assistance. DCJS always have support services and funding and resources. And we want to make sure we get localities what they need and also address some of the issues on the ground to really to address some of the stuff like gun violence and youth gang violence. And there seems to be a lot of conversations are growing across the state. There's some legislation that passed General Assembly to address gun violence on a state level, on jurisdiction level. And you should see some of that coming up soon. We have our Criminal Justice Board meeting in December. to finalize some of those things. And 2021, you get ready to see some new solicitations coming out to help support some of the efforts you guys have coming on the ground. We did some coronavirus relief funds, I think back in the fall. We may do another round based on the surge and help support some of the, help you guys on the ground as you retool how you do programming.
That's really great, Greg. Thank you so much for being here and being a part of these meetings. We're very interested in how we can access funding and resources that are available. So we really appreciate your work and your being with us. Angela, it's so great to have you back with us today.
Great to be here. Sorry, I had to run take care of something real quick at the very beginning. I didn't know if you'd called on me already or not, but so I am Angela Trainum. I'm a sergeant with the Roanoke City Sheriff's Office, and I'm the mental health coordinator. I work down in classification, but mainly work with our mental health inmates. And prior to COVID, I ran the therapeutic pod that we did for our inmates here.
Thank you so much. I think that's everybody. Is there anybody on the phone that, for whatever reason, I'm not seeing on my screen? Okay, I think we've got everybody. So I wanted to, before we hopefully get to hear from Shanel, I wanted to just follow up on a couple of things in terms of where we are. I don't know how many of you were able to watch the city council meeting on Monday when I presented our summary report of the overall study committee efforts. Council was very receptive and grateful for the work that all of you and the whole group is doing. So that was fantastic. As is my typical practice, I don't go back and review comments on the city council meetings on Facebook. I find that less than helpful for my mental health or for anything in general. But I am curious to hear any reflections you all have or any feedback you may have received just in your own thinking or from others regarding the report that we presented on Monday. I mean, you know about this work firsthand, but I'm curious if you have any thoughts or reflections on any of that. And there is silence, so I'll take that as we're good to go. Okay. A couple of updates. I had a really good conversation with Dan Bubar, who is with the Western Virginia U.S. District Attorney's Office. He was on a call with Attorney General Mark Herring last week and feels very hopeful about some initiatives that our working group is working on, and shared those with Attorney General Herring, particularly around the hiring of a youth and gang prevention coordinator. So after Dan and I talked, and I shared with him some more things that we're working on, he was also very interested in the recidivism piece, and grateful for our approach, our kind of multifaceted approach. And the thing that's refreshing for me to hear from Dan is that, you know, while he's a prosecutor, he understands the holistic aspect of this work and understands the value of it being multifaceted and a high level of community engagement. So I appreciate that, but we're going to try and set up a call right after Thanksgiving with Dan and myself and with the Attorney General and the Attorney General's Erin Ashwell, who's an attorney. She was just appointed to Attorney General Herring's office this last year. She's a Roanoke resident. And so we're going to talk further about potentially accessing some initial funding for this position. which I think would be fantastic. But the Attorney General's office is very interested in what we're doing and wants to support our efforts. So we're going to figure out how best to do that. But I wanted to give you that really good news and update. I'm very encouraged by that. I think those are the updates I have. So I'm going to share my screen and bring up our action steps so that we can review those really quickly. Can you all see these?
Yes.
Okay, great. I just want to do a quick review on some of these things to give us some insight as to where we are. So on, trying to get my days straight this week. On Wednesday morning, I went to the police department and actually spoke in one of their lineups, which they do at the start of each shift, 8 o'clock in the morning and 7 o'clock in the evening. And I was able to have a really good and extended conversation with Chief Roman, as well as Captain Puckett. And Captain Puckett works with the newly formed gang unit. And I'm really pleased with not only the work that they're doing, but the way in which they're approaching this, kind of shifting culturally from just reacting to incidents of violence, gun violence, to having a smarter approach and bringing together different departments that work collaboratively on this internally. And I think as a result of that, we haven't seen any incidents of gun violence in at least a week, maybe a little bit longer, which is very hopeful. While I was there, I met the, and here's, I met one of their criminology specialists who works in their ISTAR department, kind of their crime analysis department, and they're doing really good work. He shared with me some information about a ceasefire program that I think was very effective in Oakland, but has been duplicated in different forms in other parts of the country. And I will share with you through email what he shared with me about some of this that was done in the Baltimore area that turned out to be very effective. So I'm really pleased that we're working with Captain Puckett and hope to have him or someone from that unit join us in upcoming working group meetings so that we can continue to stay informed about what they're doing and how our work is intersecting and how we can continue to strengthen that. In terms of other action steps on this initial page, we're continuing to identify localities and programs, and we're so happy to have Shanel Lewis with us today from Richmond. Welcome. We're going to hear from you in just a few minutes to talk with us about the Safe and Thriving program there in Richmond. And as I mentioned before, we're continuing to look at ways that we can fund, to get some initial funding for a youth and gang prevention coordinator, but we want to do that as part of our comprehensive gang reduction model. And so really our focus today, I think, is to get us get our strategy developed in terms of how we want to build out this model by the end of January and get moving on it. So I'm gonna pause for the moment right now. And Jim, I'm going to have you introduce Shanel. And then Shanel, we are so happy to have you with us today and look forward to hearing from you. This, Jim probably told you, but this is one of 5 working groups that are part of our Gun Violence Reduction Study Committee work in the city of Roanoke. And our focus is specifically reducing gang activity and violence, as well as reducing incarceration recidivism. So we're happy to have you today, and I'm going to ask Jim if he will introduce you.
Thank you. I've just gotten to know Shanel through the phone and some email contact, and so I'm really excited to speak with her. She has agreed to be very helpful to us in coming to these meetings and seeing what it is and tell us their experiences, how they started up with Safe and Thriving Richmond, which is a great little book here that you've got here that is a very interesting reading, and I appreciate you sending that out to us because it does a lot of the work that we're hoping to do, and so we're excited to have you and look forward to hearing from you. And I'll let you introduce yourself better than I can possibly do. So Shanel Lewis is here for us.
Hi, good morning, everyone. I am so sorry I'm a few minutes late. These meetings these days tend to be backed right up to one another. And so I lost the track of time, but I am here. Thank you all for inviting me to share a little bit. I keep looking over my shoulder. I have an 8-month-old and he's sleeping behind me. So I'm trying to make sure he's still asleep. Yes, thank you for having me this morning. And yeah, I am the youth violence prevention specialist here in the city of Richmond. I've been with the city of Richmond for going on 4 years now. And prior to that, I worked in the city of Hampton as the youth violence prevention coordinator for 2 years. So I've been in this work for a little bit of time here, and have really been trying to do a lot of work to engage the community, mobilize the community, and just really thinking about how do we create more equitable, safe, healthy neighborhoods. And so in that work, you all do, or I assume the document was sent out to everyone for you all just to kind of take a look at that. And so I will just kind of go over, our process, both for building the document and then just how implementation has been going. And we'll even touch on a little bit of the information that we were able to collect out of our process that we walk through. But with my work currently, I oversee a coalition of over 30 partners. And much like this group, it's comprised of different disciplines, as well as community residents. And so the work that we do is really focused on collective impact around youth violence. And so we received a federal grant back in 2017 from OJJDP to develop a strategic plan. The plan is a 5-year plan. And we went through a 1-year planning, and then we received funding for 2 years of implementation. Our second year of implementation actually concluded in October, this past October, but we did receive an extension, so we are still plugging away actively at our plan. The planning process literally took about a year, everything from data collection to just walking through what our problem is and really trying to define our problem. And particularly here in Richmond, what we were noticing is that we were having a lot of young people who were being introduced to the criminal justice system at a young age, primarily because of some of our low-lying offenses like curfew violations or disorderly conduct, or some of the smaller offenses. And then as they were being introduced to the criminal justice system, the trajectory of them continuing to be engaged in the system, and even engaged in more serious crimes, we've started to notice a trend in that direction. And so our work, particularly, was centered around, and while we do, and I did share this with Jim, we do have how we've defined our gangs is that they are more like neighborhood based, or they represent particular communities. We do have, some folks who identify with Bloods and those kinds of groups, MS-13. But we have seen the bulk of our activity with some of our neighborhood-based groups that represent our different communities. In addition to that, what we're also seeing is that our young people don't identify with the word gang. They don't define their groups as gangs. That's not a word that they would, resonate with when we would, engage them in conversations around those types of behaviors or activities. So when we really think about the organization of the groups, they're very loose in structure, not traditional hierarchy that we would see with some of our more organized gangs from a organized Blood or a Crip group or something along those lines. So essentially they just kind of identify with a group of guys or girls or friends who just kind of hang out and they just rep their neighborhood. That's kind of the bulk of what we're seeing among our young people. And Greg has some experience in that. Let me know if I'm articulating that differently. But that's just what we've noticed over the last couple of years. And so the makeup in here in Richmond is that some of our communities, particularly our public housing communities, are so close in proximity. They're actually like walking distance. A few of them are walking distance from one another. And what we term or have termed some of that around the city is it's essentially the big six. So there are 6 public housing communities with over 500 units within the each of those groups. So with that being said, we've noticed that kind of creates these pockets of concentrated poverty. And what we've noticed again, and what's mentioned in our plan, especially around defining the problem, is that those pockets of concentrated poverty, while we do see crime across the city, especially here recently, we've seen upticks in violence in those neighborhoods because they are in close proximity. That we do have young people who are repping their particular neighborhood. And right now they are feuding or have been feuding for some time now over various reasons. Social media is a big indicator of some of the activity that's going on. You can kind of pick up on things or see things. We've seen music videos, right, Greg? We've talked about this, music videos and, the stuff that they're listening to contributes to some of that as well. And it's all on social media. So for us here in Richmond with our plan, we took, with our partners, we took a few months to really just dive into some of the underlying factors, and we came up with five areas that contribute to the likelihood of a young person being engaged in violence. And those, there's a lot of data that we pulled around it. The 5 areas were lack of opportunity, educational system challenges, mental health, behavioral health, and substance use. We also recognized that there were some policies within our public school system that contributed to disproportionately removing students from a traditional learning environment to a non-traditional learning environment, which oftentimes resulted in less instruction, less supervision during the school days, and those types of challenges. And then the last one, which I don't have the plan in front of me, but the last one I believe is focused around community norms or norms to violence, and just this acceptance, and even things like retaliation, and how our community responds to violent situations, the desensitization that occurs, those all of those factors. And so we began to pull information, both quantitative and qualitative data around each of those areas, or actually rather the qualitative data actually drove the decision to pick those 5 areas. We did a lot of focus groups with our young people and caregivers, and listened to their input. And that is how we derived those 5 areas. And then we went back and looked at some of the data to see if it supported those issues. And it did. And so from there, we then took those issues, we took the data, we took the information, and we sat down with our coalition to just take a look at it all, just kind of process it. It took us 2 meetings to go through. It was a packet like this thick of information. Then we identified which partners connected to which issue area, and our strategic priority areas, which are peaceful families, safe, healthy neighborhoods, and economic opportunity. And those 3 were directly related to some of the risk factors that we were seeing in the city of Richmond. But they were reframed to be more positive. So family management and conflict were 2 risk factors that were really prevalent in the city. We reframed that to be peaceful families, to intentionally focus on that. Safe, healthy neighborhoods. Again, that is the community norms to violence. That is just safe spaces, lack of safe spaces, or places for youth to come together and engage in just pro-social activities, identifying that there were gaps in pro-social activities once you kind of aged out of traditional programming, particularly around parks and recreation, and there's an age out process around 15. And if you're not involved in anything at the school, then there's really not a whole lot of actual activities outside of that for our youth. And we started to see a significant decline in that once you hit 18. So 18 to 24, where you're an adult, but you're not quite, you're still kind of transitioning, and what kind of activity supports are there in traditional programs, to just traditional views, just assume that those young people at 18 are ready to make the transition, and they're oftentimes not. So we really started to take a look at that, and we worked with our partners to identify the objectives and which agencies were tied to those objectives. I'm sorry, give me 1 second. Let me grab my son. I'm so sorry.
I hate to wish your baby not to be asleep, but I've just really been hoping this would happen. So he is so cute.
This is him. Say hi. I'm so sorry. He was sleeping on the couch and I tried to catch him before he rolled off.
Oh.
But yes. So yeah, we connected our partners. We identified who would take the lead. and who would be engaged. And for some of the objectives, you'll see that there are more than one partner identified there, because more than one partner felt as though that was something that they were connected to and that they could help move and engage in the activities and be able to report out on the performance measures. And so that is the structure of how we developed the plan. And really right now, we are actually, year one was just, again, really trying to get implementation going, get some things in place, contracts, MOUs, agreements, and get some things up and running. We've been able to take a look at, where we are post year one, and that's kind of the work that we did this summer, was really looking at our baseline data and comparing that currently to year one of implementation to see if we've seen some movement in some of our objectives, and where we're still flat. And so we do have accomplished a lot of the activities that have been listed in terms of whether they are agreements that need to be in place, partnerships that needed to be developed, pilots that were needed to be initiated, staff that were needed to be hired. All of those activities have occurred. And so now we are in year two of implementation, and we are hoping that while we've seen some positive movement on some of our objectives, we do have some that are still flat. We do have some that have declined, particularly around just the unexpected nature of COVID. But we are in the process of really trying to get a good handle on where we are with data from year one to be able to compare to year two at the end of the summer. We have one full-time person, which is me, that oversees a lot of the work, but we do have a steering committee, and that is our strategic planning subcommittee of our work group, and that steering committee is responsible for checking in on those performance measures and engaging in the hard dialogue about whether or not something is working and how we address it. And so we do meet weekly, and the challenge with again, some of the work is that you really don't see results and a whole lot of movement in the first year or even in the second year, right? That's the hard part, is this work takes some time to see some of the results. But if you get your data plan in place and you know what you want to look at and you're very clear about that on the front end, it becomes easier to start to see some of the small wins that contribute to the larger picture around impact. So I know I've talked a lot. I wanna stop and see if there are any questions.
Thank you, Shanel. That was amazing. And what a great overview of what you all are doing. If any of you have questions, just please go ahead and ask, just unmute and ask away. Jim?
Yeah, Shanel, I noticed that, you were very fortunate to have VCU do the healthy community survey.
Mm-hmm.
Did they do a lot of the research on your project as well, or was it difficult to find a research partner to get involved?
So they do actually, the Healthy Communities for Youth project is a research project currently. They are doing the project within 3 of our public housing communities. So it's not a full picture of our city, but they were able to contribute a lot of information to the process. And then previously, VCU is actually a site, a CDC site for youth violence prevention. So they do have a lot of data that they've collected on just rates of incidences among our youth 10 to 24, and have put out a lot of data sheets and summaries of just everything from intentional injuries to ambulance and and emergency department visits to criminal justice system interaction. You know, they have had and previously produced a lot of information that was used to really pull together a good scope of what's happening in the city of Richmond. They are currently still within the same 3 communities, and the way their research project works is every year they rotate to a different community and just kind of assess that particular community. And so, you know, as they continue to gather the information, we use that to inform our work. And then in addition to that, we do have a really good relationship with our with VCU Health, which is a separate entity. That's the hospital side. And they have an injury and violence prevention program and a hospital-based intervention component. And with that, they do a lot of touch points with our young adults and young people who are coming into the emergency room for gunshot wound or assault. And even with that, they have a lot of data and information that they're providing to us about, you know, those incidences related to the frequency, where they're located, those kinds of things. Any you know, information that they can share that's meeting the HIPAA guidelines.
I want to ask you one other question, and I'll let the others jump in too. You know, and this may be difficult to think of and look back and remember what challenges you might have had with the coalition to begin with, the coalition building stage, and especially since the work takes so long to really get some momentum.
Yeah.
What do you do to keep everybody together and motivated?
And I mean, I think we've had several hiccups. I'm going to be honest. We've had several hiccups, and particularly even now, where we're in the state of COVID, and the makeup of the work that our partners have previously done has, in some ways, you know, for some organizations, either taken a hit or have shifted to all virtual, or, you know, their capacity has been impacted. And so we're in a place now where organizations are really just trying to figure their own work out, while still trying to come together collectively, and still trying to find opportunities to collaborate, but still planning their own work with their own organization. So it's a tough time. We do have, you know, very different dynamics. We have organizations who have been at the table since the inception of the group back in 2008. And then we have folks who have just joined the group, you know, here within the last year or so. And the concept of collective impact sometimes just seems just that, it's a concept, right? How do you really implement a collective impact framework? And so we have had to, you know, really do a lot of work to continue to have the dialogue about what collective impact is. And even with our group, it's a coalition. The coalition is not an organization. Collectively, the partners come together to come around a common goal, but sometimes folks think of our work group or our coalition as its own entity or its own individual organization, and they're looking for specific things from the organization. And we've had to engage in dialogue with the group that, you know, that needs to be directed to the partners, and the partnership makes up our work. So, you know, just those kinds of conversations, those challenges, helping everyone see the vision. We still have folks who've been at the table for some time who still don't quite get how the, you know, the overarching plan and how, you know, organizations are sharing information or are asked to provide information or data around the particular objectives, how that contributes to the larger project, and is that taking credit for work that you're currently not doing? Like, is that the group taking credit for work they're not doing without recognizing that a particular partner is doing it? But we've had to have the conversations with folks about looking at this from the collective impact framework, where if we've agreed that we are going to implement these particular objectives, then we are moving the mission and the vision of the group. And collectively, or as a group, we are making an impact on these 11 areas through the work of particular organizations. But as a group or as a whole, we are impacting our city and creating a safer city for our youth. And so, having that creates, that's a culture shift for a lot of folks, coming out of your silos and thinking about the work from the perspective of being a part of a group of 30 folks who have committed to addressing the same issue. And while they're addressing the same issue from a different lens, collectively, when we look at the information, the data, the things that we've said we would do, we should be able to see better outcomes for our young people. And that's the ultimate goal, right?
Yeah, exactly.
So it's hard, getting folks to buy into that, getting folks to adopt that, getting folks to, to be able to see that, sometimes it takes time. It really does. It takes time. You really have to, spend a lot of time investing in the folks at the table and making sure that everyone is bought in and understands the end goal.
Yeah, I think your public health approach and experience, and having that in a coordinator it seems essential to me. Somebody who's versed in collective impact and somebody who knows a whole community approach that will help to keep these things moving along. So thank you. I'll let anybody else go.
Who else has questions? I've got several, but I'll hold it.
I'll ask one question.
Sure.
Because I look at it as, and thanks for joining us, Shanel. And again, I got experience here, but I got experience in other aspects of strategic planning. And one of the things that I always look at is one of the concerns that at least one of the things that you talked about, was trying to get disparate partners to work collaboratively together on some things over here. And one thing that we always try to do is, let's really define the scope. So my question is, if we narrowed the scope, would that help? Because it's almost like a boil the ocean approach. You get every organization imaginable under the sun who may have some tangential relationship to the community, and say, well, let's bring them all to the table. In some cases, that can cause more time, versus saying, and that's one of the things I wanted to even talk to our vice mayor about is, let's not, well, one approach that we could say is, how do we handle a certain aspect?
Yes.
Versus trying to solve world hunger, and if we narrow the scope, you narrow the participants, which by default, you narrow the focus, and then everybody can kind of work together. In your experience, now that you're a year plus into it, is that a reasonable approach to go into it?
Yes.
Not knowing that you
no, and yes, I would say, and particularly for me, because I'm one person and I'm overseeing so many moving parts. Sometimes that gets to the point where, we've really focused a lot of attention on our employment piece and creating a pilot for 18 to 24-year-olds, because that rose to the top, being when we looked at the data, when we inventoried the resources and the services available to folks in our city, when we looked at who are likely to be our victims and perpetrators and what ages they were, that rose to the top as our priority focus, even though we had other objectives, we had other opportunities to really explore. Everything initially for the first year became, let's think about the 18 to 24-year-old population. That is our target population at this current moment. We do have, young folks younger than 18, younger than 16, probably even younger than 12 who have, guns and weapons and things, but who are we seeing right now? That's our homicide victims. Who are we seeing that are in our criminal justice system? And so that's kind of how we lasered in a little bit for the first year, just to really think about our approach. And then, I would say let the data drive you into how you narrow your focus. Let the data drive you. Let it also be not just the numbers, but what's coming from your communities. And let some of that help shape where you put your focus. And it's okay to have, some priority areas where you're focusing your attention, but within those areas, really be clear about what that data is telling you.
Yeah. Good.
Great question, Elliot. Other questions? Well, let me throw out some of mine.
Sure.
So I want to go back to kind of where you started about the grant that you all received to develop the strategic plan through the OJJDC. And maybe you may be able to answer this, Shanel. Greg, you might be able to help us with this. Where did this funding come from? Is it still available? Is this something we could access as Roanoke City?
So the grant that we have in the city of Richmond, and I'll just give you a caveat, like before even we received the grant, and I wasn't here at the time, but before we received the grant, we did have, because I work for the state, the health department, the health department is allocated some funding from CDC. And I believe every health department is allocated some funding from CDC for particular issues. And we were receiving funding for our injury and violence prevention work. And so it went to the central office of the state, and the state divided that pot of money out to individual health departments, and health departments determined how they wanted to spend that funding. So we did have a pot of money that took care of my salary and created my position for the health department. And then with turnover in administration, some of that funding went away. And so that is where a lot of the work transitioned and kicked full gear into the OJJDP grant. The grant they applied for in 2016 and were awarded it in 2017. It is a federal grant. And so I believe they found it on grants.gov, just kind of searching for some opportunities to sustain or enhance some of the violence prevention work, because it took care of a staff person, but it really didn't help support organizations to be able to do the work. And I think that's where the group identified, as a priority, being able to help increase the capacity of some of the organizations if we really wanted to. I'm so sorry. If we really wanted to and do this work and be able to come together collectively, what resources were available. And so in saying that, I don't think they put out another announcement after this cohort. That's not to say that there won't be one this coming spring, but usually once they close out a cohort, they'll post an application for another grant. I've seen several grants available for like violence prevention within school settings, and different things along those lines. But I definitely think that as you all kind of walk through this process and are able to identify, where your focus is, it'll help you figure out what grant opportunities meet those needs. And so we just submitted a solicitation with essentially a plan of how we were going to engage our coalition in the work. This grant called for a collaborative group to design a plan, and we had a group in place. So we just submitted the information about the group, the plan about how we were going to go about the process, and they were awarded. And this is again prior to me coming to the health department. And then when I came in 2017, 2 weeks after I started, I was told we were awarded this grant, and my plate grew. So I say all that to say, I would just keep looking out for those opportunities. And again, as you engage in this work and really identify those areas, you'll find ways to tie in the different announcements that come out. From grants.gov, OJJDP, or OJ, Office of Justice Prevention, I believe is the acronym, or Office of Justice Programs. I don't know, can't remember what the P stands for, but they're the larger umbrella, and under them is OJJDP, as well as OVC, which is the Office of Victims. I don't remember what the C stands for, but it's focused on addressing victims' violence. And so those are two major funding streams from the federal level that directly tie oftentimes to our youth violence prevention work. And then there's BJA, what's the acronym? Bureau of Justice Administration. And so they also have some funding. And then I'll let Greg talk about the DCJS stuff.
Okay. Just to go back a little bit, back on November 10th, the Senate and Congress met to talk about Title II funding. $70 million was proposed for Title II programming, which is what Shanel has to do the grant. Congress also recommended $100 million in mentoring services for youth, $50 million in Title V split as a follow-up for preventing human trafficking for girls, $10 million for tribal youth programs, $500,000 for internet site providing for information on researches and resources for children of incarcerated parents, $3 million for competitive grants focused on girls in juvenile justice system, and $10 million for opiate affected youth initiative. They also added additional category for related children exposed to violence, and that's an $8 million cap. This is supposed to be agreed upon House and Senate, and if passed, there's probably be more funding available for youth programs under OJJDP than it was in the previous year. This is for 2021. Now, not talking about burn grants, which is from the Department of Justice, which you guys received for the reset coordinator. That money as well will be allocated. You should start seeing some solicitation no later than the beginning of December or the beginning of January for the federal government. As I mentioned earlier, we have funding available for gun violence, which will be a solicitation that will come out for 5 localities. Funding will be awarded based on the number of incidents of gun violence. And I'm trying to think of some of the other categories, but it's a total of $2.6 million. And that's awarded to 5 localities. I think you guys were in the juvenile one, if I'm correct. Right. So,
Right.
Yeah, so that's an opportunity. Like I said, that money was for planning, implementing, sustaining, and which will also support some of the ongoing work that is being done in Roanoke, which will sort of mirror what Shanel has done in Richmond. Like Shanel said, it's a lot. It's not an easy task. It takes a lot of collaboration. Collective impact is a must when you're dealing with so many different committees. The Inspire work group works underneath the Juvenile Justice Collaborative, and the JJC, as everybody knows, if you have administrative changes, new folks come in, new administration with the mayor's office, appoints new directors. It's like you got to go back and talk to folks over and over again to get the buy-in. But more importantly, the issue is how do we protect our most vulnerable population? And that's the number one priority. I think when you look at a lot of this local governments, specifically in our urban areas, Richmond, Petersburg, Roanoke, Newport News, Portsmouth, Hampton, and Norfolk, everyone seems to have the same issues that's going on. I would take my hat off to Roanoke because you guys are a little bit more, you have it. And it's just how do you coordinate the efforts to make sure it's the execution is correct. But I think that the possibilities is endless, specifically as funding and resources come available, it will sustain the projects that you guys currently have.
Thanks, Greg. That's really helpful. And Shanel, thank you for that. My second question kind of goes back to when you were talking about gangs. And this is kind of in two parts, but language is really important. And you, Shanel, you talked about how the youth that you've been having conversations with don't even use gang as part of their language. I think that's really important for us to hear. And to be honest, I don't know what youth are using locally when they talk about this. I mean, we have some community partners who I think could help us understand that based on the conversations they're having. So that's one piece of it. And the other piece of it is, how were you able to access the youth, to have these conversations with the youth? What were some of the various ways that you went about doing that?
Yeah. So, and I will say, a lot of our plan, just as an overarching note, is that a lot of our plan is, you'll see the desired outcome is to change the norm or the behavior. And so that is how we've gotten at, addressing some of the incidences or things that we would see from some of the individuals that we would define as gangs because they're of the activity that they do, but because again, the young people don't recognize that, don't identify with that term. We just didn't put it in our plan. We just didn't define it that way. But we've worked with a variety of folks at our table. We have, particularly with my work, I am more of the coordinator of this work. I don't do direct services. I don't have young people that I meet with or see every day. So we've really had to rely on the relationships and the connections of some of our service providers who are currently at the table. We do have some folks who, like, for example, we have in Greg's previous role, we were able to engage some young people. Greg was the director of community programs for justice services. And he worked with our young people who were in the detention center. And we also worked with other groups. We have a group called Bryce for Youth, and they work particularly with young people who have been impacted by the criminal justice system or engaged with the criminal justice system. And they are really working right now to advocate against mass incarceration of youth. And addressing the facilities and really advocating for changes in the facilities of young people who are committed. And so we've also worked with here in Richmond, groups called like Performing Statistics. They've done work to really elevate the youth experience of being incarcerated and through art. And they do like a justice parade every year, and they have a virtual art exhibit where it's like you're actually in a cell and you're listening to the different testimonies and stories of folks. And then we've even worked with groups like our Mayor's Youth Academy, who have traditionally engaged, youth who are not involved in the criminal justice system. And the Mayor's Youth Academy, even with their like summer work experience program and just their youth group that meets regularly. They have a youth mayor. They have a group of young people who come together regularly. And again, those would not be, for the most part, those would not be our young people who have been interfaced with the criminal justice system. But, you know, we've tried to engage a variety of folks, young people in this process, and really looked at our community partners to help support that. We've done focus groups, we've done community conversations, we've done events where they're youth-led, town halls. We've done a whole host of opportunities and activities. We've done even showcases where youth have written songs about things that are they've experienced or are seeing in their neighborhood, or that has been occurring, and they've created a song or a rap to it, and have performed it, and, you know, have a message behind it, spoken word, all kinds of different outlets for getting this information from our young people. And again, we've tried to really think about those opportunities where youth are leading or tapping into things that they're already doing around these issues, and just providing the support and you know, getting their voice in a lot of our process.
Thank you.
I appreciate you all and your patience.
Oh, you're fine.
He's
so
excited.
It's so wonderful to hear his song.
You're a rock star to be able to manage all of those distractions and still sound intelligent. I don't think I'd be able to form a thought. So, and just also to say there's hope for you, Shanel, because my son is also present for this meeting, but he's 13 and sitting over there with his earbuds in and his phone implemented. So eventually
I
they
was
become
okay.
less of
I
a
mean,
distraction.
he was napping, and you know, it takes him a little bit of time to kind of wake up from the grogginess, and now he's wide open. Say hi, man.
Hi.
But yes, I hope that answers your question. I got a little distracted towards the end.
That's very helpful. And I think there's one more that I want to ask right now, and that has to do with data.
Mhm.
Elliot mentioned this as part of our focus. You know, we've really been drawing on data, that working closely with our police department, but my sense is we really need to broaden out in a big way.
Yeah.
And figuring out who to partner with to help us really access this data, both quantitative and qualitative. And I know that VCU has been a big part of this. We, of course, have Virginia Tech. We have Radford, which has a criminal justice program. We also we have a research institute here that's connected with our School of Medicine, you know, looking at this from a public health perspective. What are your recommendations to us in terms of how to expand our data, and what would be some possible avenues that we should explore sooner rather than later to help us get this bigger picture?
Yeah, I actually, most of our process was around a community needs assessment, and initially, and from that needs assessment, our grantor actually defined a lot of the data elements that we needed to be taking a look at, or at least considering in our process. And I'm happy to share, you know, that list with you all to just kind of get you thinking. But you're definitely going to want to look at, you know, some of the major touch points for our youth. That's the criminal justice system, your police data, your school data, and then even maybe doing an inventory of like, what are some of the pro-social activities, like what does out of school time look like for your young people? That's kind of where I would initially start. You know, then you can look at your health data, your social determinants of health. And then when you think about your qualitative data, I would just generally think about concepts of safety for your youth and families, and really trying to gauge, perspective on that from those individuals. In some ways, with our qualitative data and just the conversations we've had with our youth and families, while we had prompts and, specific things that we wanted to know, we did kind of allow the conversation to just go where it went. Because in some cases, people are really wanting to talk about this and address this and find solutions to this, these issues, and maybe have not been asked, for their input in this process. And so you'll find that there's just folks just might have a lot to say, and you might not necessarily need those prompts, but I would use that qualitative data to try to figure out where the gaps are in the information. You have all the numbers and all the data that the different agencies can provide, but then you have the perception and the perspective piece that you will need to gather from your residents.
That's
but I can share the full list of recommended data points for the work that we did.
That would be really helpful. Thank you. And I think you really identified, we've got, as we've seen a major uptick in incidents of gun violence, and in Roanoke, it's been predominantly that, and it's been predominantly youth based this year particularly. What I've been observing in the community is, kind of across the board, a frustration, a deep sadness and frustration about why this is happening, what can we do to address it. And I'm not sure that we as a task force have really been prepared to know how to engage the larger community in these conversations. We're taking steps to do that. And I think, when we look at how to hear those stories, how to gauge that feedback, how to get those perspectives, I think that's probably going to be one of our first steps in terms of how we go about doing that. And I've shared with the rest of this working group, we've got a kind of a strategic session focused really on this, messaging, getting perspectives, getting community engagement in early December. And I'm going to bring to that group this idea that you've talked about, that how to use our communication to get this perception and perspective of community members of all ages, and how to use that qualitatively to help guide some of what we need quantitatively.
Right. Well, and because the numbers can tell one story, but perception and perspective are reality for a lot of folks who live in the neighborhoods and the communities who are directly impacted by the violence. And so the numbers don't always, and we all know, don't always tell the full story. So it's key to balance that with what folks are experiencing, especially in wherever the pockets are where you're starting to see the rise or the increase in violence.
Exactly. What other questions do the rest of you have?
And maybe it's not necessarily, I think, to your point about the task force not really being ready, but that's where I would recommend you identify a partner who is already well-respected, trusted, engaged in the community, that can be that arm for you. And again, like I said, because I don't, and I definitely rely on key partners. We have a youth engagement subcommittee, and it's made up of a lot of the partners who do the direct service, who touch the young people every day, and they help drive, a lot of what our methods around engaging our young people, and then they directly connect their youth so that their youth are actually leading these opportunities.
I think that's a really good point, and something we need to really give some thought to. I know that, Jamie, I know that Family Service is one of those organizations. I know there are others, and we have to think about this through the lens of, a community partner that is well respected throughout, not just in certain communities.
And we've done both. We've done well respected throughout for our citywide, and then if we've done intentionally targeted events, we've looked for folks within those specific areas. And I will say, just with like our Youth Violence Prevention Week, when we do our activities for the week, we try to make sure that we have events in all areas of the city, the four corners of the city. And when we're in a particular area, we're specifically thinking about who those folks are in that particular area of the city or within those communities surrounding, to be the MC or to help facilitate or whatever the case may be the face of that, because that's who the folks would recognize or identify. So, I mean, I think either approach is appropriate. I think, prioritizing, some of where you hear the information. Again, if you're starting to see upticks or rise in violence in certain areas of the city, I would, think about, how do you engage some folks from those areas? And it doesn't have to be a big push or a big event or something, just some individual dialogue. Maybe that's with folks who are providing services, just to kind of gauge what they're, what's going on. And that'll kind of help craft what kind of questions you want to ask, what you want to know. And then, of course, just really hearing citywide. We've really also utilized, in the city of Hampton, we utilized our school system to help us collect information from our young people. And we do somewhat here in Richmond too with our YRBS survey. And we have some violence related questions on the YRBS survey that we've added to that process, so that we're collecting information from, hundreds of students at one time.
Yeah, our Roanoke City Schools is going to be launching in the next month a what's called Panorama, but it's a survey based on social emotional learning. And we've actually gotten permission from our new superintendent to have access to that data in our work. So that's going to be a big boost to what we're doing. What I don't know is if in that survey there are any questions, what kinds of questions are related to safety,
Sure.
to health, to violence, and we can find that out.
But yeah, I mean, I think either approach is helpful. If you identify those folks, if you're targeting a particular area, or you're kind of moving, if you're doing a series of these kind of conversations, and because I mean, those are helpful. Every community, has different needs, and it's not going to be a one size fits all kind of approach to this community engagement process. You have some folks who are more connected than others. You have some folks who have more access than others. You have some folks who, have just more resources in their communities than others. And so, the conversations, the community-based conversations also is a really good method to hearing from folks.
Great. Well, I appreciate everyone's time today. Shanel, thank you so much.
Yeah.
This has been fantastic. And thanks for your willingness to follow up with us with the data points.
Mhm.
That's going to be extremely helpful. For the group as a whole, would you all be open to reconvening not next Friday, but the following Friday, December 4th, to look at our next steps? That'd be good.
I'm okay.
All right, great. And I'll follow up in an email some of what we've shared today, as well as I'll send you the link to this this meeting today, so that if you want to review it, the information presented today has been extraordinary.
Thank you.
Now, Shanel, if we could make you the youth prevention specialist for the United States of America.
I don't claim to be that much of an expert. I just you know, have really good resources and a really good support system, and have just kind of explored and learned from other cities, much like you all are doing. So I have no doubt that after you all go through this process, you will be just as much an expert as I will be.
Well, you're doing great work. And I think you've helped us realize, as Elliot alluded to earlier, that the more we can focus our efforts and rethink some of the ways that we're doing this, as well as focusing on collective impact. It's not that all of what we're doing isn't important, but I think the more we can focus our effort based on the quantitative and qualitative data, that's going to be really helpful to us as we build this out.
Yeah.
So,
Yeah.
All right. Well, thank you all. Does anyone have any other comments before we sign off for today?
I had one quick question for Greg. You said that the funding that was coming was the 5 localities would be based on the number of gun-related incidents, if I heard that correctly.
Yeah, right now we're in the planning process of drafting up the solicitation, and believe, don't pre-quote me on it, but that is one of the things that we're trying to make sure that we give everyone a fair opportunity. But those that have the most struggles, those that have the most
I was just wondering if there would be any sort of per capita
data
part of that equation.
Yeah, say for instance, if you have hold on a second. I'm gonna give y'all something, but just don't share this.
What happens in this webinar, this Zoom stays in this Zoom, Greg?
Well, no, it's just based on your population and the number of events that happen in your population, say per capita, say if you got 200,000, maybe 50,000. If you have 50 acts of gun violence or 50 homicides or more or less, funding is tied to that. That's all.
Yeah, that was my question, is are we competing with larger cities? When you factor in per capita, that kind of evens the playing field for a smaller city like that.
Well, we ran the data on a lot of the localities, specifically those that really have the biggest, having the biggest issues. I think Petersburg is south of Richmond, has some serious issues going on. And, but, there's opportunities for, municipalities such as Roanoke to really take advantage of the funding. And not, my thing is I don't, tell people don't get scared that you might not get it because we make sure that the localities that have the most impact, the most, challenge, and the ones that already have things on the ground can really be supported by our resources. So, once that solicitation comes out, you'll see some more stuff coming out as well, and some other funding, burn grants, and one-time, initiatives that can really support what's going on. Because what we say, there's a lot of issues going on in these localities that really need some, help. So.
Thank you for that clarification. I appreciate that.
All right. Thank you all so much. Shanel, thank you again for your time with us today.
Thank you all.
Thanks. Thanks, everybody.
Appreciate it, everybody. Have a good
Happy
weekend
holiday.
and a happy Thanksgiving.
Thank you. Happy
Hey,
Thanksgiving.
Mr. Hopkins.
Bye.
Hopkins, I actually sent you a private email, a private chat message.
Mm-hmm.
Take a look at it, please. if you would.
Okay, gotcha. Let me take that on.
I gave you a place to respond. We don't need to hold up.
Okay, no problem.
Yeah.
All right,
Something. All right, Jay, thanks.
thanks.